Hello, everyone, and welcome back to the channel. If you're pregnant, planning for birth, or simply curious about what labor actually feels like, then you're in the right place. One of the most common questions expectant mothers ask is, how painful is labor really? It's completely understandable. Movies, television shows, social media, and even stories from family members often make labor seem frightening and unbearable. By the time many women reach the third trimester, they have heard so many different birth stories that it's hard to know what to believe. Some women describe labor as the worst pain imaginable. Others say it was intense but manageable. Some even say they would do it all again without hesitation because meeting their baby made every moment worthwhile. So, which one is true? The honest answer is that every labor experience is different. No two women experience labor in exactly the same way, and even the same woman may have completely different experiences with different pregnancies. Your body is unique, your baby is unique, and every birth unfolds differently. That means there isn't one simple answer that fits everyone, but there's something even more important to understand. Many women spend months asking, how painful will labor be? When a much better question is, how can I prepare my body and mind to handle labor with confidence? That single shift in thinking can completely change how you experience birth. Today, we're going to talk honestly about labor pain, why it happens, what your body is actually doing during contractions, and how your mindset can make an enormous difference. By the end of this video, my goal isn't to convince you that labor doesn't hurt. Instead, I want you to understand that labor pain has a purpose, and when you understand that purpose, birth often feels much less frightening. Let's begin with what labor actually is. Labor isn't your body working against you. It's your body working for you. Throughout pregnancy, your uterus has been protecting and growing your baby. As labor begins, those powerful uterine muscles start contracting in a coordinated rhythm. These contractions gently pull the cervix upward while also encouraging it to soften, thin, and open. At the same time, they guide your baby lower into the birth canal. Every contraction has a job. Instead of thinking of contractions as random pain, try thinking of them as powerful waves. Each wave rises, reaches a peak, and then slowly fades away before another one begins. Between those waves, your body gets a chance to rest. Those breaks are incredibly important because they allow both you and your baby to recover before the next contraction arrives. Many childbirth educators actually prefer the word surges instead of contractions because it reminds mothers that these sensations come in waves rather than remaining constant. During early labor, contractions often feel similar to menstrual cramps. You may notice a dull ache across your lower abdomen or lower back. Some women describe it as pressure rather than pain. Others say it feels like stomach cramps or backache. At this stage, contractions are usually mild enough that many women continue talking, walking, cooking, or even watching television between them. Some women don't even realize labor has officially begun because the sensations are still quite manageable. As labor progresses, however, those contractions gradually become stronger. The muscles of the uterus tighten with greater intensity, your cervix continues opening, and your baby moves deeper into the pelvis. This often creates increasing pressure through the hips, pelvis, thighs, and lower back. Many mothers notice that contractions begin wrapping around from the back toward the front of the abdomen like a tightening belt. Others feel intense pressure deep inside the pelvis. Some women experience shaking, nausea, or emotional changes as labor becomes more active. All of these experiences can be completely normal. Eventually, labor reaches what is often called the transition phase. This is usually the most intense part before pushing begins. During transition, contractions are stronger, longer, and closer together. Many women suddenly feel overwhelmed and think they can't continue. Ironically, this is often a sign that birth is getting very close. Transition can feel emotionally challenging because your body is working incredibly hard. You may feel exhausted, emotional, or discouraged. Some women cry, some become very quiet, others need constant encouragement from their support team. It's important to remember that these feelings don't mean something is wrong. They usually mean your body is doing exactly what it needs to do. Then comes the pushing stage. By this point, many women notice that the sensations change. Instead of simply feeling contractions, they experience enormous pressure deep in the pelvis. Some describe it as feeling like they need to have a bowel movement. Others say it feels like their body is naturally pushing without conscious effort. As the baby's head stretches the vaginal tissues, many mothers describe a strong burning sensation often called the ring of fire. While that sounds intimidating, it usually lasts only a short time before the baby's head is born. Then, almost unbelievably, that intense pressure quickly changes into overwhelming relief as the rest of the baby's body follows. This is one of the reasons labor is so unique. The sensations are powerful, but they're also temporary. Every contraction ends, every stage eventually passes, every wave brings your baby one step closer to being in your arms. Now let's talk about something that often surprises people. Pain during labor isn't the same as pain from an injury. If you accidentally touch a hot stove or break a bone, pain is warning your brain that something is damaged. That pain exists to protect you. Labor is different. During a healthy labor, your body isn't being injured. It's performing an incredibly complex biological process that has allowed humans to give birth for thousands of years. Yes, tissues stretch. Yes, muscles work extremely hard. Yes, the sensations can be intense, but your body is designed to do this. Understanding that difference can change the way you respond emotionally to labor. Instead of thinking, something bad is happening, you can begin reminding yourself, my body is working exactly as it should. That doesn't magically remove discomfort, but it often reduces fear. And fear plays a much bigger role in labor than many people realize. We'll explore exactly how fear affects labor, why your brain influences your birth experience, and practical ways to reduce discomfort naturally. Now let's explore one of the biggest reasons labor feels so different from one woman to another. Your mind and your body are deeply connected. Pregnancy and birth are not just physical experiences. They are emotional, mental, and hormonal experiences as well. The thoughts you have, the environment around you, and the way you respond to contractions can influence how you experience labor. This doesn't mean labor pain is all in your head. The sensations are very real, but your brain has a powerful effect on how those sensations are interpreted. When you understand this connection, you gain one of the most valuable tools for a calmer and more confident birth. Many childbirth educators talk about something called the fear, tension, pain cycle. Imagine that labor begins and you immediately become frightened because you expect every contraction to be unbearable. Fear causes your body to tighten. Your shoulders rise, your jaw clenches, your hands become stiff, and even the muscles around your pelvis become tense. When your muscles tighten, your body has to work harder during each contraction, making those sensations feel stronger and more uncomfortable. As the discomfort increases, your fear grows, creating even more tension. Before long, your body becomes trapped in a cycle where fear creates tension, tension increases pain, and increased pain creates even more fear. The wonderful news is that this cycle can be interrupted. One of the most effective ways to do that is through education. When you understand what is happening inside your body, contractions become less mysterious and less frightening. Instead of wondering if something is wrong every time a contraction begins, you recognize that your uterus is doing exactly what it was designed to do. Your cervix is gradually opening, your baby is moving lower, and every wave has a purpose. Knowledge doesn't erase intensity, but it often replaces panic with confidence. Breathing is another powerful tool. Many women assume breathing techniques are simply about taking deep breaths, but there is much more to it than that. Slow, steady breathing helps your nervous system remain calm. It encourages your body to stay relaxed and supports a healthy flow of oxygen to both you and your baby. During contractions, try breathing in slowly through your nose and exhaling gently through your mouth. Focus on making each exhale longer than each inhale. As you breathe out, imagine releasing tension from your face, shoulders, hands, and pelvic muscles. Even if contractions become intense, returning your attention to your breathing gives your mind something positive to focus on instead of becoming overwhelmed. Movement can also make a remarkable difference during labor. Many women instinctively want to walk, sway, rock their hips, lean forward, or gently bounce on a birth ball. These natural movements help your baby find a good position while also reducing pressure in certain areas of the pelvis. Remaining in one position for long periods may make labor feel more uncomfortable, while changing positions regularly often helps you cope better with contractions. Listening to your body and allowing yourself to move naturally can make labor feel more manageable. Your birth environment matters more than many people realize. Bright lights, loud noises, constant interruptions, or feeling watched can make it difficult to relax. On the other hand, a calm, quiet environment can encourage your body to release helpful birth hormones. Dim lighting, soft music, encouraging words from your support team, and feeling emotionally safe all contribute to a more peaceful labor experience. When your body feels secure, it is often easier to remain calm and work with each contraction instead of fighting against it. Support from the people around you also plays an important role. Whether it's your partner, a family member, a trusted friend, a midwife, a nurse, or a doula, having someone who encourages you can make an enormous difference. Sometimes you simply need someone to remind you that you're doing well. Gentle reassurance, holding your hand, helping you change positions, offering water, or reminding you to breathe may sound like small actions, but during labor, they can have a powerful impact. Feeling supported helps reduce anxiety and increases confidence. It's also important to remember that there is no prize for enduring unnecessary suffering. Every woman has different needs, different medical situations, and different birth plans. Some mothers choose to use natural comfort techniques throughout labor. Others decide to use pain relief options such as medication or an epidural. Choosing pain relief does not mean you have failed, and choosing an unmedicated birth does not make someone stronger than anyone else. The goal is not to prove how much pain you can tolerate. The goal is a healthy mother, a healthy baby, and a birth experience where you feel respected and supported. One of the most empowering things you can do during pregnancy is prepare before labor begins. Attend childbirth education classes, learn relaxation techniques, practice breathing exercises, discuss your birth preferences with your healthcare provider, and talk openly with your birth partner about how they can support you. The more familiar these tools become before labor starts, the easier it is to use them when contractions become stronger. Preparation builds confidence, and confidence often reduces fear. Perhaps the most important message I want you to remember is this: labor is not a test that you have to pass. It is a journey that brings your baby into the world. There will likely be moments that challenge you, moments that surprise you, and moments when you question your own strength. But remember that every contraction has an ending. Every stage of labor moves you closer to meeting your baby, and your body has been preparing for this remarkable day throughout your entire pregnancy. Trust yourself, stay informed, lean on your support team, and take each contraction one at a time. In the next part, we'll talk about practical comfort techniques, pain management options, and how to create a birth experience that helps you feel calm, confident, and empowered. Thank you so much for watching. If you found this video helpful, don't forget to like, subscribe, and share it with another expecting mom who could use a little encouragement. I wish you a healthy pregnancy, a safe delivery, and a beautiful birth experience. I'll see you in the next video.